CDC confirms first case of severe bird flu in the U.S. Today, we're diving into a significant health development as the Centers for Disease Control and Prevention, or CDC, has confirmed the first case of severe bird flu in the United States. This alarming news comes from Louisiana, where a patient has been hospitalized. What does this mean for public health, and what should you know about bird flu? Let's explore. Segment 1, Understanding Bird Flu. First, let's understand what bird flu is. Bird flu, or avian influenza, is an infectious disease caused by viruses that primarily affect birds, but can also infect other animals, including humans. The strain currently making headlines is the H5N1 virus, which has been detected in wild birds and poultry across the USA. Though most strains of bird flu pose little risk to humans, certain variants can lead to severe illness. The CDC reported that the Louisiana patient was exposed to sick and dead birds in backyard flocks. This case marks a significant point as it's the first human infection linked to backyard poultry. Segment 2, The Current Situation. According to CDC data, there have been 61 reported human cases of bird flu in the U.S. since April. Most of these cases involve direct contact with infected livestock. Until now, cases had been mild, with patients recovering after antiviral treatment. However, this recent case in Louisiana is concerning due to its severity. While previous cases were mild, this patient required hospitalization. The CDC emphasizes that although there is no detected person-to-person transmission, those who work closely with birds or poultry are at higher risk. Segment 3, Symptoms and Prevention. So, what should you look out for? Symptoms of bird flu in humans can range from mild to severe. Common signs include sore throat, cough, fever, runny nose, headaches, fatigue, and even shortness of breath. In rare cases, it can lead to pneumonia requiring hospitalization. To prevent infection, the CDC recommends avoiding exposure to sick birds and practicing good hygiene. Infected birds shed viruses through their saliva and feces. It's crucial for those working with livestock or poultry to follow safety guidelines provided by health authorities. The main symptoms of bird flu, avian influenza, in humans can vary but generally include the following. Fever. Often a high temperature or feeling feverish. Cough. This can be persistent and may be accompanied by shortness of breath. Sore throat, a common symptom that may accompany other respiratory issues. Muscle or body aches. Generalized pain similar to that experienced during other types of influenza. Headache can range from mild to severe. Fatigue, a feeling of extreme tiredness or lack of energy. Runny or stuffy nose, congestion similar to common cold symptoms. Shortness of breath or difficulty breathing. This can indicate more severe respiratory involvement. Less common symptoms may include diarrhea, nausea, and vomiting conjunctivitis, pink eye. Notably, many cases have reported this symptom, suggesting a possible attraction of the virus to eye tissue. Chest pain. Bleeding from the nose and gums. Symptoms typically appear within 3 to 10 days after exposure to the virus, and while many cases are mild, severe complications such as pneumonia can occur, necessitating hospitalization. It's crucial for individuals who have had close contact with infected birds or environments to monitor their health and seek medical attention if they develop these symptoms. Segment 4, Recent Developments. In response to this outbreak, the U.S. Department of Agriculture has implemented new measures. They will be collecting raw milk samples nationwide for testing after traces of the bird flu virus were found in raw milk from a California farm. The farm has since issued a recall on all its raw milk products and has been placed under quarantine by state health officials. This highlights the interconnectedness of animal health and public health. Segment 5, Conclusion. In conclusion, while the risk to the general public remains low at this time, vigilance is essential. We must stay informed about avian influenza as it continues to evolve. If you work with birds or livestock or live near them, take precautions seriously. Thank you for watching. If you found this information helpful, please like this video and subscribe for more updates on public health issues. Stay safe and informed. For anyone seeking quick, private, and confidential HIV testing, don't hesitate to visit hivrnatest.com for essential information. We have more than 4,500 plus testing labs across the United States. Your health is a priority, and we're here to support you every step of the way.